Namaste. I'm Dr. Nikhil Varge and today I'm going to discuss with you heart diseases. World Heart Day is celebrated on 29 September to increase the awareness about heart diseases. Heart, the most important organ without which we cannot live for a single minute. It is situated in the chest and is surrounded by the bony cages and performs an important function of pumping oxygenated blood to all the organs. There are different processes which can affect the heart. The most common are coronary artery diseases, which is about occlusion of the heart blood vessels by plaques. There can be disease of the valves, there can be disease about the pumping failure of the heart resulting into heart failure, and there are arrhythmias which are about abnormal heart rates. Heart diseases are the leading cause of death all over the world. In India also, in a population more than 40 years of age, 25% of the adults die of heart diseases. There are definitely defined risk factors about heart diseases. Some of them can be easily controlled, like diabetes, blood pressure, cholesterol levels, and sedentary lifestyle. Also, the addictions like smoking and alcohol are also responsible. Whenever we think of evaluating for heart disease, it includes blood pressure measurement, blood test, ECG, treadmill test, echo, in some indicated patients CT coronary angiography, and conventional angiography. The ECG is the commonest first line test and it is a screening test which is applicable to most of the heart conditions. It is generally available round the clock in most of the hospitals and takes around 10 minutes to complete. It should be routinely done in patients who has diabetes or blood pressure every year and in patients who are more than 50 years of age as a screening test. This is how the ECG is done. Next test is the treadmill test, which includes testing of the heart's blood supply during activity and exercise. It is going to detect any ischemia if present, and if the test is positive, these patients are subjected to angiography if required. In this test, you are made to walk on a treadmill and ECG electrodes are connected to your chest. The next test is the echo, which is a very important test and it is done commonly by experienced cardiologists. The test is going to detect any structural or functional abnormalities in the heart and it is generally useful for management of all cardiac conditions. It is generally advised to do an echo every year in a person who is having diabetes or blood pressure, and also it is indicated in patients more than 50 years of age who are symptomatic. Echo is generally done by using a sonography machine and you can actually call it a sonography of the heart. It is a bedside test and takes around 15 minutes to complete. What are the symptoms of heart disease? They can vary from simple chest pain, breathlessness, as good as symptoms of pressure or discomfort in the chest. Sometimes it can cause dizziness and giddiness, and sometimes only fatigue and exhaustion can be a symptom of heart disease. Whenever anyone from your family is having such symptoms, please feel free to contact us and we are here to help you out. Take care.